Hello friends, welcome back to our YouTube channel. Today we will discuss image-based questions with explanation. Watch this video till end.
In this question, answer is B. Oppenheim test. To test for the presence of an upper motor neuron lesion, examiner uses her hand to scratch along the crest of the patient's tibia in a downward motion. A normal, negative response is no reaction. An abnormal, positive response is a plantar response, MBBS sign. Q. In this question, answer is D. Normally the muscle contracts as one, with no independent control of the upper vs the lower, or left vs right, parts of the muscle. Beaver's sign describes the upward movement of the umbilicus when performing either of these maneuvers, due to weakness of the lower part of the rectus abdominis. Where this sign help in diagnosis, spinal lesions, the rectus abdominis muscle at the level of the umbilicus is supplied by the T10 nerve roots. Lesions of the spinal cord or roots between T10 and T12 will cause weakness of the lower part of the muscle, and thus a positive Beaver's sign. In question, answer is B. Hoffman's reflex. This reflex is used to assess the upper motor neuron injury. A positive Hoffman's sign is suggestive of corticospinal tract dysfunction, localized to the cervical segments of the spinal cord. In this regard, it is analogous to the Babinski sign. In this question, answer is B. Wattenberg's reflex. Wattenberg's sign refers to the slightly greater abduction of the fifth digit, due to weakness or paralysis of the adducting palmar interosseous muscle and unopposed action of the radial innervated extensor muscles digiti minimi digitum communis. Wattenberg's sign to elicit patient's fingers are interlocked with examiner's fingers and pulled, holding examiner's palm pronated and patient's palm supinated. Normally thumb extends. In pyramidal lesion, thumb is flexed and adducted. This is a sign of flexor hypertonia occurring in upper limb. This sign is equivalent of Babinski of lower limb. In this question, answer is Jędrusek maneuver. The patient clenches the teeth, flexes both sets of fingers into a hook-like form, and interlocks those sets of fingers together. The tendon below the patient's knee is then hit with a reflex hammer to elicit the patellar reflex. In this question, answer is Wolff-Parkinson-White syndrome.
Answer A. Achalasia results from progressive degeneration of myenteric plexus ganglion cells, either idiopathic or due to Chagas disease.
In this question, answer is esophageal varices, tortuous, enlarged, smooth enhancing tubular structures. Close-up of the lower esophagus during a barium swallow shows multiple serpiginous filling defects in the barium column from varices protruding into the lumen from the wall. In this question, answer is pulled up scum. Barium study, narrowing of the terminal ileum, thickening and gaping of the ileocecal valve, thickening and hypermotility of the cecum, pulled up cecum, away from the right iliac fossa, due to fibrotic changes in the mesocolon.
In this question, answer is cobblestone appearance. Others is corkscrew esophagus, rosary bead esophagus, diffuse esophageal spasm, pseudodiverticular may be present. All are true. Thank you for watching. Please do subscribe.